Dr. Pujil Gulati. I'm a gynecologist and an IVF specialist. Wish you all a very happy Navratri. If you're Hindu, Muslim or Jain, sometimes our religion does ask us to actually take a fast. But if you are pregnant and you are planning to fast, then there are a lot of things that I would like to bring into light that you should take care of. If you are planning to fast, you need to ask your doctor, especially if you are pregnant. You should have a normal hemoglobin and should not suffer from diseases like diabetes. Number 2, you should always be hydrated during pregnancy. So it is not recommended to do a Nirjal fast during pregnancy. Pregnancy brings in a lot of signs and symptoms like acidity, nausea, tiredness, fatigue, and an overall changed sugar pattern. So all these signs and symptoms of pregnancy get aggravated once you're pregnant. So taking a good fluid intake throughout the pregnancy and even during your Navratra fasting is very important. If still you plan to fast, there are certain modifications you can do in your fast, like maintaining a diet diary. A diet diary is very important because it helps us to take a fast. With that, it also helps us to divide the nutritional intake that you require in a day being pregnant to take in a day. So at the end of the day, you can just see if your nutrition intake is adequate to match pregnancy. If you are fasting, which is not recommended in cases of diabetes, then the consequences can be very severe. You can land up having hypoglycemia, that is the glucose levels falls down, or you may feel dizzy, or in some cases even there is loss of vision that certain patients tell us. So it is not recommended that if you have any alignment that with your pregnancy, that you should actually opt for fasting. It is very important to know that you are carrying another life, and whatever you eat, breathe and think directly affects your baby. I would also like to stress upon the point that I just mentioned about maintaining a diet diary. This helps us to not only to see the nutritional intake, it also helps us to even monitor the fluid intake, which is a must during pregnancy. After discussing how you can fast during pregnancy, I would like to stress upon the effects of fasting, the bad effects of fasting. If you are anemic, that means your hemoglobin is low and you have fasted and you are at the 9th month of pregnancy, it can cause preterm labor. It can have long-term effects on the baby. It can also cause fetal hypoxia, means lack of oxygen to your baby. So firstly, I would recommend to take a healthy diet and take yourself as a preference and a baby as a preference, and not do fasting which may not suit you, or do it in a very monitored manner. Lastly, if you still have any doubts regarding the nutritional plan that you should take during pregnancy, you are most welcome to contact us, number given below. Thank you very much.